Krana Plus is the peak body for remote and isolated health professionals. We are a member-based, not-for-profit organisation supporting and educating the rural and remote health workforce. Made possible through a grant from the Commonwealth Department of Health, Krana Plus is proud to be delivering mental health training for health professionals in drought and bushfire-affected communities.
In keeping with the spirit of reconciliation, Krana Plus acknowledges the Aboriginal and Torres Strait Islander peoples as the traditional owners of Australia. We pay our respects to their elders, both past and present, and their emerging leaders. We acknowledge any Aboriginal and Torres Strait Islander people watching this webinar series.
Hello, my name's Jane Nursey. I'm the Clinical Services Director at Phoenixaustralia. And I'm here to speak to you today about responding to disasters, and particularly level 2 interventions for helping people who've been impacted by disasters. Just get my screen up for you. Okay, before I begin, I'd just like to acknowledge the traditional owners of these lands that I am on. Acknowledge the place of age-old ceremonies, celebration, initiation and renewal, and the local Aboriginal peoples who have had and continue to have a unique role in these lands. So very briefly, I'm going to give you a bit of an introduction and background about disasters. You're all going to know this, so I'm going to go through this quite quickly. But we know that people who live through a disaster, who experience disasters, really can experience a full range of reactions to that disaster, including experiencing high emotions, having their basic assumptions about life, the world, family, friends and others challenged, encountering a huge number of stresses in the post-disaster recovery period around rebuilding or re-establishing homes, perhaps needing to move out of areas, working through all the paperwork in terms of insurance claims and other government funding. And just living in a community that is recovering from a devastating impact can be stressful in itself. As we know, the impacts of the disaster spread far and wide, and there's ripple effects across communities, and the multiple impacts that they have across environment, community, buildings, natural environment, finances, and the sort of human psychological impacts all coalesce together and can get very caught up in impacting the person as a whole. And sometimes it's very difficult for that person to pull apart what might be the issues that are impacting them the most. From a mental health point of view, there's a range of different experiences, and it's important to say that not everyone is going to have a strong emotional reaction, or certainly not a prolonged one. They might experience some very intense emotions at the time of the event, and maybe for the first few days and weeks afterwards, but the majority of people will recover pretty well from that, get back to a level of functioning that allows them to get on with the job of recovery and moving on with their lives. So people can have positive reactions, they can have negative or bad reactions, or they might have a mixture of both. They can have very strong and severe reactions, or they can have very mild reactions. And those reactions might be very brief, or they might be long-lasting. The majority of people are going to recover pretty well. And when I say the majority of people, at least 80% of people who live through a disaster are going to recover pretty well on their own without the need for any other, for any extra and particularly professional support or intervention. This graph really does just provide a bit of an overview of what are the typical patterns of recovery that we see in communities? And the most common one here is the blue line, the resilient, those people who are resilient. And we see here that at the time of the event, there might be an intense reaction that decreases their level of functioning, but that will slowly rebuild over the coming weeks and months, and they'll get back to a fairly high level of functioning, very similar to how they were prior to the event. Other groups, there's some that are quite resilient and manage very well throughout the whole event, and don't seem to show any real impacts. There's a group who seem to be quite resilient, who cope very well for a prolonged period of time perhaps, but then down the track perhaps fall over, begin to be experiencing some significant distress, maybe can't focus, can't concentrate, can't sleep well, maybe that's impacting on their relationships and on their work life. And then there's another group who are perhaps the smallest group of people who really don't cope well at the time of the event and don't recover well. Now, these are obviously generalisations, and it's more likely that these are going to be jagged lines, all of them, that people are going to have some ups and downs across time. But by and large, I guess what we're saying is the majority of people will do okay in the long term. But there'll be a percentage of people, whether it's a delayed impact or a chronic one, who have difficulty in their recovery. So what is the role of health workers in supporting these people who've been through a disaster? There's a range of different guidelines that are out there to support that. Phoenixaustralia produces the Australian guidelines for the treatment of acute stress disorder and post-traumatic stress disorder, and they are just about to be launched. The new version of those guidelines is about to be launched as an online guide, which will be easy to access and read. But pretty much universally across the world, the guides around providing support for people following a disaster is that there needs to be a stepped care approach to it. We need to allow people to recover on their own, to draw on their natural resilience, their natural strengths, and the support they have around them in terms of their relationships with their families and friends and their community to help see them through that recovery period. So we don't want to be rushing in early. But what we can do is provide support at a level that connects them into the people they need to be connected with, that reminds them about their strengths, and then that encourages them and supports them through that process. So a stepped care approach really does ensure that individuals receive care that's appropriate to the level of their distress and the time point in their recovery. It does mean that people need to be monitored over time, and that there's some capacity to be checking in on friends, neighbours and others, and being aware of where to seek help when it's needed. And the idea is that as people's distress becomes more prolonged or recovery becomes more complicated, then there's increasing levels of intense interventions that can be offered. So this is a graph that shows the sorts of interventions that are available. So the first is psychological first aid, level 1. So this is at a very general level. It's about advice, simple, practical, emotional support to anyone who's in the affected community. And generally we would suggest that this gets rolled out and offered to everyone living in the community. Step 2 are simple psychological strategies that help to build resilience. And level 3 are your more formal mental health interventions that are delivered by mental health professionals and are really designed to treat mental health, diagnosable mental health disorders. So just another way of looking at this graph is looking at the sorts of people who can provide these different levels of care. So at the base level, we have things like psychological first aid being delivered by members of the community who are trained to deliver that. And that includes Red Cross volunteers, it includes other community volunteers or community members who have gone off and done that training. Level 2 is can be delivered by primary care providers, but it doesn't have to be primary care providers. It can again be lay people who've received specific training in a level 2 intervention. And level 3 is really interventions delivered by mental health professionals. A premise around providing support following disaster is, and what level 2 and what level 1 and 2 interventions is based on, is 5 principles of recovery that were developed by an international group of experts in trauma and disaster led by Hobfall. And they came up with really 5 early intervention principles. The first is one of safety, that first and foremost, it's about making sure the person is safe and that they're kept safe and that they're living in a safe environment. The second is calming, so providing opportunities for the person to calm down, teach them strategies perhaps that help them to manage those distressing feelings and allow them to calm down. The third is connectedness, and that is about making sure that they're connected in with the right social supports. We know that social support is the biggest predictor of recovery, so that those without good social support are at most highest risk of developing a mental health disorder post-disaster. Whereas those that have good social support are at a lower risk. Self-efficacy is the fourth one, and that is about reminding people about their own strengths and encouraging them to draw on those, so that they're building their own self-efficacy about knowing that they can get through this. They've lived through other difficult situations in the past, they've managed those well, and drawing on those strengths and getting reward from being able to do it themselves. And then the final one is hope, the idea that things are bad at the moment, but they will change, they will get better. I'm not going to go into psychological first aid, most of you will be aware of it, but the steps in psychological first aid you can see from this slide very much align with those 5 principles of safety, calm, connectedness, hope, and self-efficacy. So I want to now just focus on the level 2 interventions. Level 2 interventions are designed for those people who really are showing some more prolonged distress. So if we think about psychological first aid or level 1 interventions being in those first days and weeks post-event, when there is a high level of tension still in the community, of anxiety, of distress, and it's just really calming people down and connecting them. Level 2 is for those people where over the coming months their distress levels aren't settling. They've not yet developed a mental health disorder, but the level of distress is at a level where it is stopping them from getting on with the recovery processes and causing concern for them and their family and loved members, and or interfering with their capacity to work or in their relationships. So they're generally brief interventions aimed at selective issues that the person might have and ways of managing their distress around those. They are designed to be delivered by non-mental health professionals, and as I said, that could include primary healthcare workers. It might also include first responders and emergency service personnel. It might include government, local government staff, and or state or Commonwealth government staff, and certainly volunteer support workers. It's meant to be easy to deliver, and it is about teaching skills, and there might be one session with a person, there might be 4 or 5 sessions with a person, but it's very targeted at what is the specific issue that the person has. So there's 3 different level 2 interventions that are currently out being used across the world in various levels of uptake. The first one is Skills for Psychological Recovery, or SPR. So this was a package that was developed again by a group of international academics and clinicians with expertise in trauma and disaster. It was led by the US National Centre for PTSD and the National Child Traumatic Stress Network in the aftermath of Hurricane Katrina. You can access this package through those websites, and I'll have a page at the end and you will get the slides where you can go and access it. But at phoenixaustralia, we also are able to train people in SPR. So what is SPR? It's a package of recommended strategies to assist people to gain skills to reduce their distress and cope more effectively following disaster. There are multiple strategies, but each one can stand alone. So again, you might just get one opportunity to meet with someone, perhaps working as a volunteer or as a nurse in primary healthcare, and that's the one opportunity that you have. So you would choose the particular skill that's going to target the issue that's most problematic for the person and teach that skill. Alternatively, you might have a chance to see them on a repeated occasion and be able to teach them a suite of skills. The idea is that they do go away with some homework to practice the skill and put it into practice in their life, and to be able to come back and perhaps reflect on how it went and maybe help, with your help, modify it to make it more effective if it hasn't worked that well. It's designed to be flexible and tailored to the individual. So you're not going in with the idea that I'm going to work through each of these skills in a set order, in a set time frame, regardless of what the person presents with. It is very much about identifying what's the immediate needs of the person and which of the skills is going to best help them manage that problem. Important to emphasise that this is not therapy. It's not designed for people who have diagnosable mental health disorders, although it no doubt would assist those people too, to some extent. It is evidence informed, so it is based on strategies and skills that are built into evidence-based interventions for depression and anxiety and those sorts of things. And I'll come now to what are the skills that we're talking about. I sort of talked about the goals, but certainly it's about protecting mental health. It's about building resilience and enhancing people's capacity to cope. It's about building that self-efficacy that we've talked about in the principles. It is designed to be used across the age range, so that there are some child-specific examples in there that can be used. It isn't a cookbook. It's while it's manualised in the sense that it's all there for you in a manual, but it's not about let's just work through this in a systematic way, as I said. It isn't about you establishing a therapeutic relationship with the client. You know, it is assumed that you have basic empathy, and from that process you'll be engaging with this person, that they have come along with a willingness to learn a skill, but you're not going to be doing an in-depth assessment of them. You're not going to be doing a case formulation in terms of what their mental health status is. You'll be using your natural instincts to build rapport with these people. It's expected that they will be delivered in a compassionate, flexible and responsive manner, and that is necessary to facilitate appropriate engagement and identify the needs. So for those of you who might work as social workers or psychologists, it is a very different process. You know, you won't be having the luxury of time of a prolonged history taking and early sessions of getting to know you and building that engagement and rapport. That's not what it's about. It is relying on your warmth, your empathy to build immediate rapport with these people, and to be offering them a skill that they can take away. So the core components. The first one is gathering information and prioritising assistance. So this is really just teaching you about how you go in and within 5 or 10 minutes can establish what is the presenting issue for this person, what is the main thing that is troubling them. And really it's as simple as asking that question. What is the thing that is most difficult for you at the moment? What is the thing that is causing you most concern? And then going with that. There's a table there that can help you choose from the list of skills that SPR teaches, that you might then with them decide that's the one that you're going to work on in this particular session. You might want to be obtaining some basic information in that session about basic needs and concerns as well, and their social supports around them. So there's 4 skills that you could offer then are building problem solving skills. So a very basic and very quick approach to problem solving would take 15 minutes to teach someone to go through that process of identifying the problem, brainstorming some solutions, going through and choosing the one most likely to have success, problem solving around any of those barriers, and then putting it into practice. Promoting positive activities. So this very much coming out of behavioural activation for the treatment of depression, and is about that whole idea of getting people engaged in fun, positive things in order to lift their mood. We know that the recovery process is full of stressors, full of sadness, full of difficulties in engaging across a whole range of very unfamiliar environments and organisations and people. And so positive activities is a really important time out period for people where they can actually just get back to the idea of feeling something pleasant and having some fun. Managing reactions is a module that's built around teaching self-calming skills. So whether that be some mindfulness, whether it be some calm breathing, progressive muscle relaxation, use of exercise, yoga, importance of diet, all of those sorts of things that as health professionals you might teach others to use as a way of calming themselves down. Promoting helpful thinking, coming from cognitive behavioural therapy, and the idea of helping people to identify repetitive, upsetting or unhelpful thoughts that are driving perhaps their lowered mood or anxiety, and helping them to counter those thoughts with something that's more productive for them. So it isn't about denying perhaps the reality of what's triggering those thoughts. It's not about saying stop this, but it's about saying what's a different way of approaching this, what's a different way for me to think about it, so they get out of that negative thinking loop. And then finally, rebuilding healthy social connections. So here, recognise the importance of social connectedness and the idea that for some people, a natural reaction following disaster is to withdraw, to self-isolate, to confine yourself to a place where you feel safe. But that in fact is going to have perhaps not negative implications in the long term if they remain isolated. So helping them to re-engage, helping them to identify the people within their social networks and within their community that they can turn to for support and help. That's skills for psychological recovery. A second one that was developed by, again, an international panel of experts led by Phoenixaustralia. So we held 2 roundtable meetings that were funded by the Prince's Trust, and Prince Charles attended those meetings at some part of them. So a collection of people, experts from US, UK, Australia, Europe as well, getting together to think through how might we put packages together, one for children and one for adults, to address again those sort of main principles of recovery. So SOLA stands for Skills for Life Adjustment and Resilience, and it follows pretty much a similar pattern as SPR. It takes a transdiagnostic approach in the sense that people will be experiencing anxiety issues, perhaps some mood issues, certainly perhaps some intrusive memories and those sorts of things, but not at the point where they're clinically diagnosable with a disorder. So it includes behavioural activation strategies, it includes arousal and affect management strategies, it includes teaching about healthy living, teaching them strategies to manage rumination and worry. It takes them through a narrative processing of the trauma, so teaching them a strategy to be able to keep a journal or use writing as a technique of perhaps managing intrusive thoughts or images they might be having. And it's about promoting healthy relationships, and that's social connected as well. So you can see quite similar to SPR, a slightly different focus in some of them, but very much drawn from an evidence base around mood, anxiety and PTSD. With the idea that it's encouraging and supporting the person to maintain their well-being. The final one is Problem Management Plus, and this is a program that's come out of the World Health Organization. Again, has a selection of skills that you would teach the person in order to manage the issues that they're confronting and the stress that they're feeling. So it includes arousal management, it includes problem solving, it includes activity scheduling, and it includes relapse prevention. So that's perhaps not as widely used as something like SPR. I should say that with SOLA, so that has now been, we're running trials of that at the moment to gather evidence around SOLA, and we've run trials in South Pacific countries, in Australia, and it's being trialled in US as well. One thing to say about these level 2 interventions and level 1 interventions is that it's very hard to establish an evidence base. You know, doing RCTs in mass disasters is ethically very difficult, but also just very difficult from a control point of view. So that's why many of these interventions come from a evidence-informed and expert-driven process. So key points to remember: In terms of level 2 interventions, if you're going to be delivering them, is that they're designed to support people in distress, not those people with a mental health disorder. If when you're working with someone, you've really begun to question a diagnosis and think that they might be suffering from a more significant mental health disorder, then that is time to refer on or do a more complete assessment and triage them into the appropriate treatment. It's designed to be delivered quickly and efficiently, potentially only in one session, choosing one skill, but also the possibility of seeing them perhaps multiple times and teaching a range of skills. It is not therapy, it's skills training. And while some of these skills are coming from therapeutic interventions for mental health disorders, they in and of themselves aren't therapy. It doesn't require in-depth history taking or case formulation. The expectation is that you use your basic empathy and personality to establish quick rapport with these people and gather the necessary information to target very quickly a skill that's going to be helpful to them. So hopefully that's covered off for you, giving you a good idea of what level 2 interventions look like and where they sit in the hierarchy of support for people following a disaster. Thank you.